Hello everyone. Today we'll discuss about the anatomy of soft palate. The soft palate, it is a fibromusculoglandular curtain. So this is the soft palate which hangs from the posterior margin of the hard palate. The presenting features of the soft palate is it has anterior surface which is concave, posterior surface which is convex, upper border which is attached to the posterior border or the posterior margin of the hard palate, and we have the free margin which hangs freely. Now we will see the anterior surface. It is concave and it looks forwards, downwards and forwards, whereas the posterior surface is convex and it is backwards and upwards. The upper border is attached to the posterior margin of the hard palate and the lower margin is free. From the center of the lower margin there hangs a conical projection which is called as the uvula. From the uvula, if you see, two folds arise. They are the palatoglossal arch and the palatopharyngeal arch. Inside that is present the palatine tonsil. The soft palate also has two lateral borders which is continuous with the pharynx. Now, as already discussed, the soft palate, it is a fibromusculoglandular curtain. The anterior one-third is fibrous, the middle one-third is muscular, and the lower one-third is glandular. Now, we will see what are the components of this soft palate. Soft palate, it is a bilaminar mucosal fold having the palatine muscles, the Palatine Aponeurosis. It has the nerves, the arteries and the glands. Now we will see about the Palatine Aponeurosis. So the green color structure here, that is the Palatine Aponeurosis. This Palatine Aponeurosis is formed by a muscle which is called as Tensor Veli Palatini muscle. So this is the Tensor Veli Palatini muscle. The attachment of this palatine aponeurosis is, it is attached to the undersurface of posterior margin of the hard palate up to the palatine crest. So this is attached up to the palatine crest. So it is in this region the soft palate is present. So this is the palatine aponeurosis which forms the fibrous framework of the gland, which is formed by the tensor veli palatini muscle. In the next slide, we will see the attachment of the tensor veli palatini muscle. So before studying that, we'll have to look into some of the bony features of the skull. As you all can see, this is the medial pterygoid plate, this is the lateral pterygoid plate, and this is the pterygoid hamulus. If you see here, that is the pterygoid hamulus. If you carefully observe, the medial pterygoid plate is splitting into a fossa that is called as the scaphoid fossa. So that is a scaphoid fossa. Now we will see one more thing, that is the sulcus tubae. If you all observe here carefully, there is space here, that is the sulcus tubae, which lodges the cartilaginous part of the auditory tube. So here is the sulcus tubae which lodges the cartilaginous part of the auditory tube. Now we will also see something called as the spine of sphenoid. So this is the spine of sphenoid which will be here. So having studied about these things, now before that we will see, this is the sulcus tubae in which the cartilaginous part of the auditory tube is present. This is the lateral lamina and this will be the medial lamina of cartilaginous part of the auditory tube. Now we will discuss the origin of tensor veli palatini muscle. So, tensor veli palatini muscle arises from the scaphoid fossa, as you all know. It arises from the sulcus tubae. It arises from the auditory tubes, lateral lamina, and it arises from the spine of sphenoid. So this is the spine of sphenoid. So it is from here the tensor veli palatini muscle arises. Quickly revising, it arises from the scaphoid fossa, it arises from the sulcus tubae and the lateral margin of the cartilaginous part of the auditory tube and the spine of the sphenoid. So it is a triangular shaped muscle. After arising, it passes. After arising, it passes above, hooks around the lateral aspect of the pterygoid hamulus, and it forms an expanded palatine aponeurosis. So the same thing occurs on the opposite side as well. So that is about the tensor veli palatini muscle, which forms the palatine aponeurosis. Now we'll discuss the next muscle, which is the levator veli palatini muscle. This was for the revision of tensor veli palatini muscle, which arises from the scaphoid fossa, which arises from the sulcus tubae, which arises from the cartilaginous part of the cartilaginous part of the auditory tubes, lateral lamina, and the spine of sphenoid. Then the muscle passes upwards. It hooks around the lateral aspect of the pterygoid hamulus and forms the expanded tendon, the expanded palatine aponeurosis. Now we will see about the levator veli palatini muscle. So this is the levator veli palatini muscle. If you observe this levator veli palatini muscle, it is forming a U-shaped sling. If you observe more carefully, this levator veli palatini muscle, it is passing, its insertion is in between the two fascicle of the palatopharyngeus muscle. So if you observe, the levator veli palatini muscle is in between the two fascicles of palatopharyngeus muscle. Now let us look into the bony attachment of the levator veli palatini muscle. For that, we will discuss about some bony feature. As you all can see, this is the carotid canal and this is the foramen lacerum. Now this is the apex of petrous part of the temporal bone, undersurface of apex of petrous part of the temporal bone. Now the levator veli palatini muscle arises from the apex of undersurface of petrous part of the temporal bone. It arises from the carotid sheath. Carotid canal is here, so carotid sheath will be there, and it arises from the medial lamina of the auditory tube. This is the auditory tube. This is the medial lamina of the auditory tube. So from the medial lamina, levator veli palatini muscle will arise. From the lateral lamina, tensor veli palatini muscle will arise. So the levator veli palatini muscle is formed by three parts: medial lamina of the cartilaginous part of the auditory tube, from the undersurface of apex of petrous part of the temporal bone, and from the carotid sheath. So after arising, what happens is, we all know that this is the pharyngeal tubercle. It is to this pharyngeal tubercle the superior constrictor muscle will be arised. We have studied in the pharynx class that in between the attachment of the superior constrictor and the base of the skull, there will exist a space that is called a sinus of Morgagni. So we studied that in the sinus of Morgagni, one content was the auditory tube and the other content was the levator veli palatini muscle. So this muscle, after arising, it passes through the sinus of Morgagni and it attaches to the upper aspect of the palatine aponeurosis. So that was about the levator veli palatini muscle. Not to forget that levator veli palatini muscle will be inserted in between. It will be inserted in between the two fascicle of palatopharyngeus muscle. So with this, we have discussed the levator veli palatini muscle and tensor veli palatini muscle. Now we will discuss, so this was about the revision. So we have the levator veli palatini muscle, which arises from the undersurface of apex of petrous part of the temporal bone, from the carotid sheath, and the medial lamina of cartilaginous part of the auditory tube. So from here it arises, it passes in the sinus of Morgagni and attaches to the upper part of Palatine Aponeurosis in between the anterior and posterior fascicle of palatopharyngeus muscle. Next we will see about the palatopharyngeus muscle. So in this diagram, we will see the palatopharyngeus. We have already discussed that palatopharyngeus, it has two fascicles. They are the anterior fascicle and the posterior fascicle, and this is the palatopharyngeus, which is in between the insertion of levator veli palatini muscle. So this that is palatopharyngeus muscle arises by two fascicle. The anterior fascicle arises from the hard palate and upper part of the palatine aponeurosis. The posterior fascicle arises from lower part of palatine aponeurosis. Both the fascicle will join and it will descend posterolaterally. As it descends, it forms a fold that is called as the palatopharyngeal fold. And further, as it descends into the pharynx, what happens is it is joined with other muscle. You can see here, this is the palatopharyngeus, this is the salpingopharyngeus, and it is joined by the stylopharyngeus. All the three longitudinal muscles of the pharynx, they go and they insert into the posterior border of thyroid cartilage. So this is about the palatopharyngeus. In this diagram, you can see the two fascicles of palatopharyngeus. It is joining with salpingopharyngeus, stylopharyngeus, and attaching to posterior border of thyroid cartilage. Not to forget that some fibers of palatopharyngeus, as they are descending, they form a U-shaped sling under the mucosa of the pharynx. This sling is known as palatopharyngeal sphincter. After this, we will study about we will see about the palatopharyngeus, which arises from the anterior fascicle from the hard palate, upper part of the palatine aponeurosis. The posterior fascicle from lower part of the palatine aponeurosis, it descends posterolaterally. In between will be levator veli palatini muscle. Now next, we will see about the palatoglossus. So palatoglossus is very simple. It arises from the lower aspect of the palatine aponeurosis. Lower aspect of the palatine aponeurosis. And it is attached to a fold. We will see it here. It forms a fold called as the palatoglossal fold or the palatoglossal arch, which is attached to junction of anterior 2/3 and the posterior 1/3 of the tongue. This palatoglossal arch, it will form the oropharyngeal. We will discuss the oropharyngeal isthmus. It is formed by the soft palate, it is formed by the palatoglossal arch, and it is formed by dorsal 1/3 of the tongue. So, after swallowing the food, this oropharyngeal isthmus will contract, thereby preventing regurgitation of the food from pharynx to the mouth. So that is the oropharyngeal isthmus, which is formed by the soft palate, palatoglossal arch, and dorsal 1/3 of the tongue. So after swallowing the food, this oropharyngeal isthmus will close so that the food from the pharynx is not regurgitated back to the mouth. So that was about the palatoglossus. We'll see the nerve supply of the soft palate. First, we will discuss the motor supply. All the muscles of the soft palate are supplied by the cranial part of the accessory nerve, except for the tensor veli palatini muscle, which is supplied by the nerve to medial pterygoid muscle. If you see here, this is the nerve to medial pterygoid muscle, which supplies the medial pterygoid muscle as well as the tensor veli palatini muscle. This nerve to medial pterygoid muscle is a branch from the mandibular nerve, and this nerve, it traverses the otic ganglia without relay in the ganglion. So the motor supplied to the soft palate. All the other muscles are supplied by the cranial part of the accessory nerve via the pharyngeal plexus, except for the tensor veli palatini, which is supplied by the nerve to medial pterygoid, which is in turn a branch of mandibular nerve. Now we will see about the secretomotor, how the secretomotor fibers will reach the soft palate. We will see this diagram. Now, to see how the secretomotor fibers will reach the soft palate, first imagine this is the pons. There will be superior salivatory nucleus in the pons. The preganglionic secretomotor fibers will come out through the superior salivatory nucleus. These preganglionic secretomotor fibers will travel through the nervous intermediates of the facial nerve. It will travel through the facial nerve. Once it reaches the genu of the facial nerve, these preganglionic secretomotor fibers will travel through the greater petrosal nerve. They will further travel through the nerve to the pterygoid canal, and it will relay in the pterygopalatine ganglia. Now, what is the nerve of the pterygoid canal or the Vidian nerve? We will see it in the next slide. So, the nerve to the pterygoid canal. So, nerve of the pterygoid canal is here. How it is formed? We will have to trace the sympathetic pathway of the pterygopalatine ganglion for that. We can see the postganglionic fibers coming out of the superior cervical sympathetic ganglia. They form a plexus around the internal carotid artery. From there, the deep petrosal nerve will arise. It will enter the pterygoid canal. So this deep petrosal nerve along with the greater petrosal nerve, these two nerves are called as the nerve of the pterygoid canal. So we will go back to the previous diagram. So here what we saw that the preganglionic secretomotor fibers, it came and relayed in the pterygopalatine ganglia. From here, the postganglionic fibers will reach the soft palate via the greater palatine and the lesser palatine nerves. So, a quick revision how the secretomotor fibers reach the soft palate. So, we have the pons here, we have the superior salivatory nucleus through which the preganglionic secretomotor fibers come out. They travel through the nervous intermediates of the facial nerve. They travel through the facial nerve. Once they reach the genu of the facial nerve, they travel through the greater petrosal nerve. They travel through the nerve of the pterygoid canal, and they relay in the pterygopalatine ganglion. The postganglionic fibers reach the soft palate via the greater palatine nerve and the lesser palatine nerve. So this is how the secretomotor fibers will reach the soft palate. So we have already discussed the motor supply. We have discussed how the secretomotor fibers reach the soft palate. Now we will discuss the how the sensory fibers of the soft palate. It is mainly by sensation of the soft palate are carried mainly by the lesser palatine nerve and the glossopharyngeal nerve. We know that the general somatic sensation of the glossopharyngeal nerve, it carries sensation from the posterior one-third of the tongue, the tonsil, the soft palate, and also the oral part of the pharynx. Now, we have discussed the motor supply. We have discussed the secretomotor fibers, how they move. We have also discussed the sensory supply. Now, we'll discuss the taste sensation, how they carry it from the soft palate. It is mainly again by the lesser palatine nerve and the glossopharyngeal nerve. We know that the glossopharyngeal nerve, it carries the taste sensation from the post-sulcus part of the tongue along with the vallet papillae, also from the soft palate. So with this, we have finished the motor supply, we have finished the sensory, we have finished how the secretomotor fibers are carried. We have also discussed about the taste sensation of the soft palate, that is by the glossopharyngeal nerve and the lesser palatine nerve. With this, we finish the soft palate. Thank you so much for watching the video.